Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about asthma. When I left off last week, I was talking about asthma and a patient who presents to the emergency room, what are the symptoms, and what needs to be done right away in order to help this patient from getting into major problem. Some 300 million folks across the world suffer from asthma. It's a very common medical problem. 11 people die from asthma every day in this country. It is a major, major problem. I misspoke last week when I stated that the incidence of asthma in black and Latinos were 2.5% higher than Caucasian. The actual number is 2.5 times higher in black Latinos than Caucasian. 2.5 times, not 2.5%. This is a much higher number than that. And the reason for that is the condition in which that most black and Latino folks find themselves in terms of where they live, the economic situation, etc., the stress that they have to deal with. All those things lend themselves to causing the symptoms of asthma to be worse, and sometimes the exposure to the living conditions create a situation where people suddenly develop asthma. It is a well-known fact that folks who are living in their own country, breathing fresh air, etc., suddenly find themselves in this country, which is a great country, and people do all kinds of stuff to try to get here. I know how hard I work, how hard I try to get to this country, so I know exactly how hard it is, and I don't fault anyone for wanting to come to this country so long as they do it in a legal way. Having said that, it is a well-known fact these folks will be here within a month to 6 weeks after they come here. Some of them wind up in the emergency room having frequent recurrent asthma attack when heretofore they never even heard the word asthma before, because when they were in their countries they were breathing fresh air. We didn't have all these pollutants in the air. In this country you have the crowding, all the emission that comes out of the cars and the trucks, and the fume that's coming out in the chimney, all the different factories, etc. We have to breathe all that stuff. And furthermore, these folks live in houses that are most of the time infested with roaches, mice, rats, and other vermins that carry the inhalant on the skin that these people forced to inhale. They carry these toxic pollutants, allergens, and then once you inhale that stuff, suddenly your upper airway becomes irritated, and the irritation then leads to an inflammation. The inflammation leads to formation of secretions, and the secretions then start clogging up the bronchioles in the lungs, and the next thing you know, the person's wheezing, they cannot breathe, etc. And if they don't have the heavy secretions secondary to inflammation, then they develop bronchospasm, and the bronchospasms closes the bronchioles, and air cannot move freely, and they develop an acute asthma attack. And last week I brought with me the little gadget that people use to breathe in to determine how bad the attack is that they're having. And unfortunately, I didn't bring it with me in this segment because I rushed from the hospital to come here, and I was in the middle of making hospital rounds. I had to go back to finish that up. So so it's very, very important that when these people show up, either to the doctor's office or to the emergency room, one takes extremely emergent actions in order to prevent the patient from, frankly, dying. And the issue is when an asthmatic patient shows up in the ER, we have the peak flow meter. We give that to them to breathe in so that we know what the expiratory rate is. And then once we know that, then we can use that to see, by knowing the baseline, because most asthmatic is are taught to keep a log of the best expiratory rate that they have when they use that meter when they're not very sick, so that once they compare that, when they're very sick, they know they can't move the air, and it's time for them to go to the emergency room. The problem with most asthmatics, many of them keep treating themselves at home because we physicians give them, rightfully so, medication such as albuterol and to take, to breathe in, so to puff in, to remove the bronchospasm so they can acutely get some relief when they're having difficulty breathing. And there are many, many such medications around, and sometimes they just wait too long. They know they're having difficulty breathing, and they keep using the different medication that they have at home, and they're getting tired, and what's going to cause them to die is the tiredness. So they die of respiratory arrest because they can't breathe anymore. They're so tired. But the key is not to wait that long. As soon as you know you're having a bad one, a bad attack, you have to call 911. Make sure there's a family member around to try to get you to the hospital emergency room quickly, so that we can provide acute care for you to help you to breathe. It is, though most of these deaths are unnecessary. Sometimes the deaths occur because somebody developed a pneumonia, superimposed on an asthmatic situation, and these people went into respiratory failure and died because of the infection in the lung, etc. Sometimes they have to be intubated. Now, it is very important when you see an asthmatic in the emergency room, not only that you need to know what the peak flow is the best peak flow, because when we're going to use the peak expiratory flow, we're going to use the peak flow meter to see how much they can or cannot do. We compare that to the baseline. That's very important. Also, we need to know the history. Has that patient been hospitalized before? And how many times? Has the patient been intubated before? It's very important to differentiate the patient who's been intubated once or many times as compared to somebody who just come to get some relief. We just have to address both of them, but we have to take special care, because people who have been intubated before have a propensity to require intubation many times after that. So it's very important to know that history. So the deal is, the patient shows up in the emergency room, he or she having difficulty breathing. The first thing you would do, of course, is to get the patient peak flow, see what's going on, and quickly begin to administer medication so that the patient can use that little gadget in the mouth to breathe in and out, so that we can open up the tubes so that air can go in and out very freely, give them some oxygen, and it's very important to do a blood gas. What is the value of the blood gas? Well, the arterial blood gas tells us three things. Number one, the oxygen concentration. Number two, is the patient holding CO2? Because an asthmatic is, because of the rapidity with which they're breathing, they're constantly exhaling carbon dioxide. So the minute they begin to retain carbon dioxide, that's a red flag. That means that they're getting tired. They cannot push it. The muscles in the chest are weak. They cannot push hard enough to get the carbon dioxide out, and they're beginning to retain it. That's another important point we get from the blood gas. And of course, the pH. But the most important thing is the oxygen concentration and the CO2, to know whether the patient is retaining or not. If they're retaining CO2, that's headache, that's trouble. So you got to make a decision whether this patient can be treated by the inhalers that we are giving them in the ER, or an injection of epinephrine, the oxygen that we're giving them, and of course that this is going to be followed by a dose of IV steroid. There are different preparation of all steroid. There's Decadran. There's all sorts of different preparation of steroid. We're going to give them IV, keeping in mind that the steroid takes 6 hours to kick in. Once you give a dose of steroid, it takes 6 hours to kick in. So the acute treatment is the bronchodilators. to give the patient to dilate the bronchioles so that air can be moving in and out. The wheezing that you're hearing once we examine the patient is because the tubes are either closed from the spasm or they're clogged up with secretion. In either case, you got to take action. If it is the secretions, to give the patient medication to liquefy them. IV fluid is very important, or they can cough it up. Cough syrup is also very important. Okay, so we address that. Then of course you'll do a chest X-ray to make sure the patient doesn't have pneumonia, etc. And then of course the chest X-ray is very, very important. And then keeping in mind, as I said in the previous shows, asthma is a chronic pulmonary disease. It's not just a transient pulmonary problem as some of us were taught. It is not. It's a chronic pulmonary disease, because when people who died from asthma, they did autopsy on them, they sectioned these bronchioles, they found chronic inflammation there. So asthma is a chronic inflammatory disease, nothing to play with. All these folks who died, most of them died at home in an attempt to try to self-treat themselves. And that is something that we have to teach them, to be very careful when to call 911 and when to come to the emergency room. So once they're in the emergency room, a decision then has to be made whether they should be treated and released or they should be admitted. That depends on the peak flow, because as we treat the patients and we keep repeating using the peak flow meter to give them to breathe in and out to see what's the best, how it is improving. If the expiratory route improves to a safe level, then the patient likely can go home. If the repeat blood gas shows that the patient is no longer retaining carbon dioxide, the patient can probably go home. And how does the patient look overall, clinically? That's a decision only the examining and treating physicians can make. That's it. And this cannot be taught. This is something you gain from experience. It's a judgment. You can't teach judgment. Judgment is something you gain based on years of experience, keeping in mind, as I said many times before, 74 to 75% of what physicians do every day is based on judgment. Based on judgment. Okay, so on this kind, unfortunately, I mean, I have this book here, Health Status of African American. It has 804 pages, lots and lots of information in there. Chapter 32 is on asthma and blacks, and you could read it. There's a lot of information for you to get out of this. You could find it in the local public libraries. Take a good look at it. And this is one of many books that I've written. All these books you see over my shoulder, I wrote them. I wrote a total of 20 books. I think this one is book number 20, as a matter of fact. So the point to be made is the fact that you have to become knowledgeable. You can't be an asthmatic and don't become knowledgeable on how to handle yourself, what to do. In spite of all that, we're losing 11 people per day in this country from asthma. Okay, and that is something that has to be reversed. And the best way to reverse it is to educate. The same way we educate people about diabetes, we educate them about the heart disease and hypertension, etc. They have to be educated about asthma as to when to ask for help and what to do and what not to do. A lot of the time, these people get into trouble because they were at home self-treating themselves with medication we give them. They waited too long, and they get tired, and they stop breathing, and they die. It's unnecessary death. Okay, and asthma is very common in children as well. Lots of days of school are missed every year because of asthma attack, and kids cannot go to school because of that. And some of them, because of that, the mother has to stay home with the kids. She missed work as well. So it is a very serious problem. How do you deal with this? How do you create an environment where that people can live in a way so we don't have to deal with all this pollution. It is a free enterprise system. People are allowed to make a living by setting up different businesses, but something must be done to try to cut down on the air pollution that is in part most responsible for these asthmatic development in the first place, and we call it a tax. We call it a tax. And you have people from both sides of the political spectrum fighting with each other as to what is happening in the environment. Well, it is clear that the environment is under attack. The environment is being pretty much damaged, sometimes without repair, because of people wanting to make some profit. No one is against profit. No one is against profit. I'm all for people getting ahead in this world and in this country. But the key, do it while keeping in mind your fellow human beings that are being affected. I worked in a factory um, in the early 60s in New York City, and what I went through was nothing short of hell, because I was operating a machine that was making the old-fashioned woman hair rollers, and we had to dump this thread, this pile of thread was a big pile, into a bucket of chemical agents of different time, liquid, so as to moisten it so it doesn't emit too much dust. Didn't help. So I inhaled all that dust for 3 years working in this factory, operating this machine. We had no mask. Consequently, I wind up with operation in my nose. I wind up with operation in my throat at Polyclinic Hospital. And frankly, I almost died when I had the nose operation, because behind the stuff they put on my nose to stop the blood from coming out, I developed an infection. And I was running fever 106. I wind up at Union Square. In the back there, the ENT doctor was there. And the guy kept me in his office the whole day, giving me IV penicillin. When he removed the stuff, pus was oozing out of my nose. And when I went to the Polyclinic Hospital emergency room the night before, nobody would touch me because I was a post-op case. Only the doctor who operated on me, according to them, could touch me. Well, this guy was almost 80 years old who did the operation. He was a union-type doctor. Nice fella, nice man. So finally, when he answered the phone, I had to take the train. I didn't have enough money to take a cab to go all the way to Union Square. You know, Polyclinic Hospital was on 50th Street, 50, West 50th Street. I had to find my way to Union Square, and the poor guy gets very nervous because my neck was stiff, hurting, and I was about to die, really. But he didn't put me in a hospital. He kept me there and gave me IV penicillin the whole day. And then by the time it was 6, 7 o'clock at night, then he sent me home on PO medication. Somehow, I survived. Believe it or not, I survived that. I went home, and I survived that. And I had a friend at that time named Emma, nice lady. I looked for Emma. I don't know where she is now. She was an Italian lady. She helped me survive this by myself in a little kitchenette in Manhattan. And she helped me. She nursed me. She made soup for me, and I was in this country by myself. So Emma helped me. I look all over for Emma. I can't find her. She was older than I am, so my hair is all gray. So I think she may have gone back to Italy. I have no idea, but I did look for her to see if I can do something to help her if she needs help. Can't track her down. So I won't mention her last name, but her first name is Emma. That's who nursed me. Okay, so. And I survived that episode. So, I hate to be so personal. Every time I do these shows, I wind up telling a little bit about myself. But you have to be who you are. I am who I am. And that factory job, brutal though it was, It helped me to be where I am today. I was getting $1 an hour. I was making, I was working 8 hours a day from 9 to 5, and that job was a brutal job. Trying to go to school at night, to high school at night, whatever. It wasn't working. It was things were not working out right. So I made the decision to work even harder. I switched to the night shift, which was 6 p.m. to 7 a.m., the 10-hour shift, so that I can go to school at the Manhattan Technical Assistance School, something like that. They call it in Union Square. I will go to school 11 to 5 and work 6 to 7. And I took this course, a laboratory technician. That's how I broke through the American system. That is how I broke through. I took that course, I finished it, I became a laboratory technician, and New York City decided, in its wisdom, to license everybody who works in the lab. And what did I do? Every Saturday, I took one of those license exams, and I passed all of them. So as I speak to you now, you come to my office, I have 8 separate licenses from New York City as a technologist in the laboratory. And I wind up getting a job at Brookdale Hospital because I had the license. I hadn't finished high school yet. But if you look at me, you wouldn't believe that I was an uneducated person, because I taught myself how to speak English, taught myself how to speak French. I was a big, muscular guy with a huge afro, 240 pounds worth of muscle, very imposing looking, kind of nice looking in those days. I don't know what I look now. So I got the job because I had the license. That's all they cared about. I had the license. I supervised a laboratory at Brookdale Hospital in Brooklyn. And my breakthrough came through when I was given the permission to do my own research. And I did a research on methotrexate. And the research on methotrexate showed that methotrexate can decrease antibody production in mice. That was my breakthrough. That research, ladies and gentlemen, is the research that is responsible for all what you see today on television with all these biologics that are being sold, the good medication. They were all based on that original research that I did using methotrexate in mice. That's why methotrexate is being used to treat all rheumatological problems in humans all over the world. I did that. And that's how I get into medical school. I got into medical school in 1969. I finished high school in 67. I got into medical school in 1969. I finished college in 1970, which means that I get into medical school before I finish college. So for those who get very upset with me, very envious, very jealous of all the stuff that I have done, they've tried so hard, so desperately hard, costing me in excess of $500,000. Let me repeat that. In excess of 500,000 American dollars, defending myself in front of the New York State Health Department, because they keep reporting me for doing absolutely nothing. And I survived all that. And look at what happened today. I became a professor at Einstein, became a professor at New York Medical College. I became an M.A.C.P., one of the few people in the world to have mastered American physician. And I was just named by one of the most prestigious student group in this country as one of the 4 most notable outstanding physicians in the history of medicine in this country by way of being a minority. All this happened because I work in the factory. So brutal though the factory job was, caused me all these medical problems, it helped me to get ahead. That was my first real job. The first job I got was pushing that cart on 34th Street after being almost killed several times by the cab seat drivers. I had to give it up. And I wind up at H. Goodman and Son, working in the factory, operating that machine. So for the young men and women who don't think they can make it via the normal way, by getting themselves involved in all sorts of criminal activities and illegal activities, go the right way. Do what I did. Work hard. Go to school. Get yourself an education. Get yourself a profession. You can do it. There's nowhere in the world that you can tell me that you cannot do it. I did it. You should be able to do it too if you organize yourself. You have the ability, you have the brain. You just have got to have self-confidence in yourself. The same guy, now I have two granddaughters with doctorate degrees. I have a daughter who was a professor in Florida teaching. I did all that stuff, and yet I was a factory worker. The only job I ever quit is working in a place and whether across the Queensboro Bridge, I think it was, working in a sweatshop for 3 days. That's the only job I ever quit. It was so brutal, so nasty, in a sweatshop where these women, illegal women, were making T-shirts or whatever they were making. I won't not dare describe to you the disgusting situation that was there, that I quit after 3 days. And this man found me some 10 years later to give me that check for 2.5 days or 3 days, because by then I think I was working somewhere as a technologist, either at Brookdale or somewhere I was working, and this man found me to give me my 2.5 day check that I actually walk out of that sweatshop job. It was disgusting, filthy. So I did all that stuff. So I know what the people who have asthma, who are living in poor condition, are going through. I live in those kitchenettes. I survived the roaches. I survived the bite from the mice and the rats. I did all that. I survived the peeling paint, the hot 90-degree room. I made it. You could make it too, but you could have to do it the right way. Go to school, become educated, and get yourself a profession. And you will someday become like a Dr. Alcena. In any event, I'm stopping here. Next week, I'll wrap up the 4 shows on asthma. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.